Hi everybody, this is a video about a low-dose immunotherapy. Someone posted a question recently asking whether folks need a prescription to get low-dose immunotherapy, whether it's something that needs to be administered in a clinic, or if parents can, the video is about PANS and PANDAS, so conditions that affect children. So the question was, can parents administer the treatment themselves, or do they have to go to a clinic to have it administered? Of course, for non-pediatric patients or older pediatric patients, they could self-administer. I will answer all of those questions. Just before I jump into the crux of the video, everything I'm saying, as per usual, is for informational purposes only. This should not be construed as medical advice. If you need medical advice, please talk to your healthcare provider to get that advice. So low-dose immunotherapy, it's a wonderful treatment for many cases that I've had many cases over the course of time who have benefited profoundly from low-dose immunotherapy. It's a really unique therapy in that it's a very targeted way of addressing hypersensitivity slash allergies, for all intents and purposes, to microorganisms, hormones, other substances that folks could be reacting to. So for example, folks get infected with, say, the Lyme-causing bacteria, Borrelia burgdorferi, and the microbe gets killed off, but it leaves behind this pro-inflammatory sort of quagmire in its wake, and folks are like, oh, we're still killing infection, why aren't I getting any better? It's like, well, because the microbes are killed off, it's just the immune system dysregulation that's been left behind. And so there are some great immunomodulators out there, like quercetin and NAC and Chinese skullcap and various things like that. But what I find is that those things tend to modulate the immune system very slowly over time, whereas the low-dose immunotherapy, when you find the right dose of the right formula, it can make a huge difference very, very quickly, like sometimes within days. So it's a really great, very powerful therapy. It's not a panacea for everybody. Some patients do not have these hypersensitivities, so the therapy does nothing for them. But for the folks that it's indicated for, it's just second to none. So to answer the questions, so LDI is administered or able to be accessed through clinics. It's not something that's made by a compounding pharmacy. You don't order it from a company. You don't need a prescription for it, but you do need to have a doctor-patient relationship where someone can actually sort of dole it out through their clinic. So it doesn't require a prescription, but you need to work with somebody who uses LDI. Low-dose immunotherapy, there are not nearly as many LDI practitioners out there as there should be. I talk about it all the time when I'm talking to students at naturopathic schools, when I'm giving I teach courses to other clinicians about mitochondrial dysfunction, and I teach ozone therapy injection courses and various other courses. I'm always mentioning LDI, but the reality of it is that LDI, there's a bit of a learning curve with it, and there's a fair bit of financial investment to get the formulas, the materials needed for the formulas in question. So I think those are a couple of fairly large obstacles to clinicians, deciding to jump into the world of LDI. When I actually have a clinician training course in LDI, and it's something where I try to make it as user-friendly as possible for the clinicians, but it's tricky. A lot of clinicians actually who at least get over the first hurdle of learning how to use it, they'll oftentimes find other clinics in their neck of the woods who have the material, so they don't have to invest in them themselves. So they can send their patients there to get their LDI dosages and whatnot. So it doesn't require a prescription. And with LDI, when it was originally developed, it was administered as an injection, so you needed to get it done in a clinic. But thankfully, over the course of time, it was determined that it works just as well as an oral treatment. You might be thinking, like, how is that possible? Well, it turns out that the same immune system regulating cells called dendritic cells are present in high concentrations in the skin, just as they are present in high concentrations under the tongue. And so for the same reason that when a person has run-of-the-mill allergies, they might get allergy shots into the skin, but there's also something called sublingual immunotherapy where they use those same allergens as an under-the-tongue administration, and it works just as well, sometimes better. So that's why under-the-tongue works just as well as injection. So thankfully, because it is an under-the-tongue treatment, then it's something that can definitely be administered at home, and definitely it's preferable to administer at home, because many of us who work with low-dose immunotherapy, we have patients from all over the place because folks hear about it, they don't have a practitioner or a provider in their area who offers it, and so they need to find someone who can offer it, and sometimes they have to get things shipped out to them or whatnot because they can't be driving hundreds of kilometers or miles, depending on where you live, to be getting their various dosages and whatnot. So I hope that answered your questions about this. If you have any further questions about this, don't hesitate to post in the comment section below. If anybody else has any questions about this topic, please post in the comment section below, and I'll do my best to answer as soon as I can.